Hello, everyone. Welcome to 1.5 Degrees, the podcast where together we explore the science, solutions, and stories involved in the fight against climate change. I'm your host, Heidi Pan, speaking with the professionals behind the latest research, policies, culture, and innovations shaping our response to global environmental challenges. For today's episode, we are joined by Rachit Sharma, who is a health equity and justice-focused physician and environmental epidemiologist. His work focuses on examining the combined effects of environmental exposures, such as air pollution and outdoor temperatures, and social stressors like neighborhood violence, poverty, and racial segregation on health outcomes from an environmental and social justice lens. He also conducts epidemiological evidence evaluations for environmental hazard identification through systematic reviews and meta-analyses. Thank you so much for joining us today, Russia. It's truly such an honor.
Thank you so much. Pleasure is mine. Happy to be here and thank you for hosting.
Can you talk more about what your work as an environmental epidemiologist entails?
So, first of all, environmental epidemiologist is a person who practices the science and art of environmental epidemiology. So there are two words here, environmental epidemiology. I'll take on the latter first. So epidemiology as a discipline, what it is, it will make things simpler to understand. So epidemiology, studying how diseases are distributed in our population, in the society. And that's one important distinction from clinical sciences. We are in epidemiology, we are concerned with populations. So populations can be neighborhoods, can be cities, and you can go bigger, right? Cities, state, nations, and then global world. So epidemiology is everywhere. And what we are concerned with is how are diseases distributed and what is causing those diseases? What are the risk factors for causing those diseases? And the end goal here is that we want to identify the risk factors causing the diseases, and we want to prevent and control them so that when policies are implemented by the governments everywhere, by the city stakeholders, or everybody who's concerned with the health of the people, when they implement that, the gains are the most. And diseases which are affecting people at a population level, they are addressed. So that is what epidemiology is. And epidemiology goes further into like sub-disciplines. So there is infectious disease epidemiology, there is environmental epidemiology, there is social epidemiology, just to name a few. So infectious disease epidemiology, for example, is what people during COVID-19 pandemic did. They were telling us which groups of people are at risk, how it spreads. So that is what infectious disease people do. And social epidemiologists, they talk about how the social factors, the social constructs affect our health. And my discipline, environmental epidemiology, talks about how the environment that we live in, things that are outside of our body, and the physical elements as such in our environment, be it natural environment, such as nature, green spaces, water, blue spaces, as we call it, or the built environment. So as to say, the way the cities are built, air pollution, the physical entities, heat, right? So how they impact our health. And again, the same concept applies here. We want to identify how these are affecting our health, at what levels, with the goal of addressing these exposures and ultimately improving human health.
It's really important to clarify terms. Talking about, your area of study, how did you get here?
Yes, I get that a lot because I am from India. Growing up in an Indian family, either, when you're in high school, you either tend to become a doctor, a physician, you go into the medicine branch, or you become an engineer. These are the top two sought after careers. And then, or people join some administrative services in the Indian services, different of those. I come from a family of doctors. My father is an orthopedic surgeon. My mom is a periodontist. My older sister, she's a pathologist. So my path was sort of set out that, okay, I'm going to become a doctor as well, which I did, but not under the pressure from my family. I saw the value in that. I always was growing up, I saw what difference it can make, helping people out when it comes to their health. On a side note, I did have mathematics, and I did went for an engineering entrance exam as well. So I was preparing for both and sort of ended up uh, choosing the medicine branch because that is what I loved. So I went to med school in India, and when I was in med school, I was probably in my second or third year, when I was introduced with the subject of community medicine. Preventive and Social Medicine, or so as to say the subject's name. So that talked about how the population aspect and preventive aspect of medicine, how it's better to prevent diseases before they occur so that the healthcare systems are not burdened by the diseases that occur en masse. So that caught my eye, but still I was like, okay, this is the route I know. I'll become a clinician, a surgeon, or a medicine physician. Let's see how it goes. But as I went on in my med career back in India, I realized all the patients that are coming in, okay, they come in, you give them the medicine, they get better, but they are again going back to the same environment, the
Yeah.
same social circumstances that made them sick at first place. And there were a lot of recurrences, like anything that you can see can be linked to the environment. And that is where I was like, okay, they're going back to the same circumstances that made them
Mhm.
sick. So what can we do about those? So I caught interest in the subject of community medicine. And then eventually I came across the wonderful world of public health. I got introduced to the course of Masters in Public Health. So that is when, after my med school, I worked for a year and a half in one of the rural districts of India just to make sure that I truly like public health or not. So I was involved in a public health project. And then I was like, yes, I want to have an advanced qualification in this and get some training in public health. That is when I applied for a Master's of Public Health program in the US. And then I came to the US in 2018. I did my Master's in Public Health. And then again, I went back to India because at that time I was interested in environmental health. My MPH, Master's Public Health, introduced me to environmental health as a subject. And when we talk about environmental exposures, air pollution and heat, these exposures are very much there in India and close to home. So where I live in Delhi, air pollution levels are very high. Delhi is consistently ranked #1 capital city in the world amongst the most polluted cities. And also heat, like temperatures right now are hitting, like they're always above
Yeah.
100. And recently a heat wave was declared. Sort of 4-day heat wave is there happening right now. Uh, so I went back, there was an air quality and health project. I was involved in that for, again, a year and a half. And when I was there, I realized that, there is one way of gaining experience, that you work on different projects and you learn that way. But then I realized there is a different way that I get the technical knowledge that I need and the skills that I need to be a better scientist. And that's when I made the decision to apply for a PhD doctoral program here in the US again. Started my PhD during the pandemic. The first 2 years were like totally gone because of the pandemic. Classes were on
Yeah.
Zoom.
Mhm.
But luckily things improved and we were back on campus. And now currently I'm in my 4th year of my doctoral journey. Said, like right now I'm seeing a lot of medical doctors in India and globally here in the US as well,
Mhm.
that they're starting to talk about climate change. They are becoming great advocates. So that shift is happening. So a mix of both, I feel, whereas, the health aspect of climate change can be talked together and hopefully pushed through advocacy, and changes can happen at a faster pace.
There are a lot of terms often used in the environmental space. Your work is on environmental health inequities and disparities, but there's also environmental justice. What is the difference?
Great question. So they're sort of synonymous, but not really. People use them interchangeably, but you can see them as siblings, or more as to say that environmental health inequities and disparities are sort of downstream effects of environmental injustice. So environmental justice, first of all, there are a number of definitions. I won't go
Mhm.
into formal definition because there is not one. Every group
Yeah.
approaches that
Mhm.
differently. Environmental justice, the principally speaking, like it has a moral and ethical imperative to it. It has a component of moral and ethics. And by that, I mean that it says that all people, regardless of race, income, gender identity, and other social constructs that exist in our society, have equal rights for clean air and a healthy environment. So a clean and healthy environment is everybody's right. And it also says that all people have an equal power for decision making when it comes to environmental decisions and laws that exist, and ultimately the outcomes that affect their health and well-being. So that is environmental justice in a health context. Whereas environmental health inequities and disparities or differences, just to say simply. And so in environment, there are good and bad, right? So there are green spaces, which is good. You have a park in your neighborhood, that is good, but there are bad things too, air pollution, for example.
Yeah.
So there is good and bad, and there is an imbalance in these resources and the bad side as well. So the good resources and the bad, there is an imbalance, and this imbalance exists disproportionately across different groups. So for example, research tells us that, effects of air pollution are much more profound in Black and African American communities here in the US. In Hispanic people, the effects are much more stronger. So environmental health inequities, and these effects are compared to their counterpart, the white population groups. That's an example in terms of air pollution. That is what research is telling us more and more. So this balance is existing, but this balance is a result of environmental injustice that happened historically and continues to exist through systemic and structural factors. For example, there are discriminatory land use practices, there are zoning laws, and even when the laws are enforced, environmental laws are enforced, they are enforced in an unequal manner. So these gaps or disparities continue to exist, and we see them in the health outcomes of people. At the same time, I would like to highlight that these gaps that are there, they are because of two reasons. So first of all, the distinction between justice trickles down to inequities. These gaps lead to two things. One is the exposures, the bad things in the environment are much more higher in minoritized communities, in racial minorities, low-income groups. These exposures are higher. And at the same time, there are other social factors as well that these communities are facing, right? So there is poverty, there is neighborhood violence, there is segregation. As I said, there are race-based residential segregations that keep on happening. There's food insecurity, housing instability. So there are other stressors in these communities because of structural reasons that have been in place for a long time. And on top of that, because of these factors, on top of that, there is high air pollution and other environmental exposures as well. So there is a sort of like a combined situation that is going on that continues to widen these gaps, widen these disparities. Yeah.
Yeah. And, it's like something that we don't really think about until like we experience it ourselves. But I guess like more specifically, how do those combined environmental exposures, such as air pollution and outdoor temperatures or heat, you know, interact with those social stressors like neighborhood violence and poverty to affect human health?
Yes. Um, so as I said, like how just the 2 points that I just said, that, there are higher exposures and then there is the baseline is not comparable between uh, population groups that are marginalized and those who are in privilege, so as to say. So the baseline is different because of all these social constructs that are there, these social evils, so as to say. So poverty, housing instability, neighborhood violence, these continue to exist at a much higher rate in marginalized community groups. Um, and then on top of that, they also suffer from higher air pollution levels and heat as such. So research is telling us that. But if I talk about research in deeper, to answer your question, research tells us that because of these stressors, social stress, these like these events or conditions that that people perceive as harm to them over a longer term, it causes like chronic stress. These are like chronic stressors. If there is crime in my neighborhood, it's a chronic stressor, right? Over a period of time, I'll be like stressed about these things. And research tells us that more and more, that all these chronic stressors, social stressors, so as to say, they change our physiological system, our body, the way our body operates. So it affects our immune system, it affects our endocrine system, which is how the hormones are made. So that is the endocrine system. It affects our metabolic system. So that baseline is different between different groups of people, right? Because of these social stressors. And then on top of that, as I said, air pollution and heat, they are also higher. So it is not that, one day I wake up, I'm like, oh, I'm just going to focus on air pollution today and not worry about the crime in my neighborhood.
They're all related and they happen simultaneously.
Exactly, you answered it. They all are happening at the same time. We cannot draw a line, okay, I'm just gonna just focus on one today. So that is where the thinking of quantifying the combined effects come into play. And the same mechanisms, the same physiological changes that are brought on by chronic stress, the same research tells us that the same effects are brought on by physical exposures, environmental exposures, such as air pollution and heat. So the body doesn't know, cannot differentiate, but the same things are happening in the body, be it a physical chemical like air pollution or metals, or be it something that is a chronic stressor. I'm stressed about my living conditions, my housing instability, my food insecurity, right? So these are stressors, which are, so as to say, non-chemical stressors, and there are chemical stressors, air pollution, heat, which are bringing about the same body changes. So there is a cumulative effect, so as to say, a combined effect in the body. And that is why we see differences in across population groups. So communities who are experiencing these social stressors are increasingly being shown to have stronger effects of air pollution and heat.
Mhm.
And that is where my work comes in. That is what I'm trying to do. Yeah.
I guess like what are some specific health outcomes that you've identified as being most impacted by the intersection of environmental exposure, social stressors like we've discussed so far?
So this discipline of the intersection of social epidemiology, so as to say, and environmental epidemiology is fairly new.
Mhm.
These disciplines have existed for a long time by on their own, but now more and more researchers are talking about like considering them together. So the research is still coming up, but the evidence is pretty strong. So just to list a few, there is asthma that is talked
Mhm.
about and other respiratory outcomes. There is combined effect of the two, social fact stressors as well as environmental pollutants. And then there is metabolic outcomes such as high blood pressure, diabetes, and then not just physical outcomes, but also mental outcomes. So my work currently in my PhD, I'm looking at neurological outcomes. So my work is on seizures and epilepsy.
Mhm.
And thereby also I'm seeing that, effect of pollution is much more profound in different groups, across different groups. And these groups happen to be racially minoritized. So this is where I'm seeing that. And then also mental health outcomes like depression, anxiety, and down the lane, neurodegenerative outcomes as well, dementia, Alzheimer's. So research is evolving. So, but as you know, these pollutants as well as chronic stress, they affect every body system in the body. So I'm pretty sure more and more research is going to be coming out.
In terms of conducting systematic reviews and meta-analyses, we're diving into the technical aspects. For evaluating epidemiological evidence on environmental hazards, what is their purpose?
That's a great question. So when we talk about research broadly, there are two kinds of research. One is the original research that you collect the data or you analyze some publicly available data and you produce your own original findings. But when you do that, that's just one study that I did. In my doctoral study, in my journey, I'm doing some work, but it's on a very narrow topic and I'm just publishing one study. Early, some other group might also address the same topic somewhere else, and they might have a different finding or the same finding, uh, which may or may not match with mine. And there are different reasons for that, why, findings may not match. We're looking at different people. The population that we are studying is different. We have different methods that we applied for, doing the research, a number of reasons that how and why research findings might be different. But even if we are addressing the same topic, there will be differences and there will be some synergy between them. Like, they will
Yeah.
be saying the same thing or may say different things. So that is the whole purpose of doing a systematic review or a meta-analysis. That if we want to say, for example, air pollution causes asthma, why it is so much known? Because first of all, there was a lot of individual research studies that came out, and then somebody said, okay, let me look at all these studies together. What is the evidence pointing towards? Does air pollution really cause asthma? Or is there some discrepancy in all these studies? So through systematic reviews and meta-analysis, we want to put all the evidence on a particular topic into one place and evaluate. So it's not one person deciding either. Systematic reviews is usually a team so that,
Mhm.
you are able to, so there is no bias involved. Like it's not my personal bias.
Yeah.
There are others to check the same thing. So a team of people are looking at the entire evidence, body of evidence on a particular topic, and they want to say, yes, the evidence is consistent across these studies. Yes, air pollution can be a root cause of asthma. And once that is identified, that is what is helpful for the policymakers as well, that, okay, all the studies are in one place. Instead of reading like 100 papers on this topic, I can just look at this one document and see what the evidence is telling. So that is the power of systematic reviews and meta-analysis, that you put all the studies together and you can push the messaging right forward, and you can address the research gaps as well. If the studies are different, what are the differences? Why these differences could be occurring? So you can give some future research directions as well. And also for practice, uh, like for clinical practice, for implementation of policies. So that's a good space to do that. Yeah.
Yeah. I recently had I recently had the privilege of having an opportunity to do some like beginner systematic analyses myself. Yeah. And it definitely is like saving time for people down the line to be able to implement the work. Yeah.
Yes. Yeah.
Really appreciate that. We're kind of going back now to your PhD. My dad jokingly, he has a PhD in physics, and he jokingly calls it permanent head damage. What is some advice that you wish you personally had received when you were starting your PhD journey? And can you talk more in depth about what that was like?
Absolutely. My uncle calls a PhD as poor, hungry, and driven. That is what he says, which is to a lot of extent, it's true. uh, but yeah, to answer your question, like if I go back to my PhD, what I would have known, uh, starting off, I would have known that research is slow. Good research is slow, like it takes time because you want to be sure of what you are putting out there. Research is slow, but that said, it does not mean research is not useful. It's very important. A lot of the health policy changes, uh, the rules and regulations that change, they come from all this good evidence that we produce. So scientists are doing a great job. Research, it just takes time. So when you come in as a young person, trying to achieve something, trying to change the world, you don't realize that, and you think that, my research is gonna be pushed forward, it's gonna change the world. It doesn't happen that way. A bummer. But that said, whatever you produce, it will be utilized down the lane. And I've seen those examples uh, in public health, in environmental health. I've seen my senior co-authors, my seniors in the field, how they are called as experts in the courtroom in EPA, and they're talking about the entire evidence that is there, and they are the ones like eventually putting it forward. And they are called because they have done this useful research in their careers. It's a slow process, but that does not mean I don't mean to demotivate people.
Mhm.
If research is moving slowly, you don't need to wait to tell people that air pollution is bad for you.
Mhm.
I think most people would agree air pollution is bad for them. So what I would encourage is, even though you are like doing research and it might be slow, look for other opportunities that you can push, through which you can push the narrative forward. Talking to grassroots organizations, see if you can help them as a scientist. Do they need some simpler analysis to be done? That might be enough for them,
Mhm.
right? Just a simple analysis where the polluting sites are in their neighborhood. That's enough for them. For you, it might be like scientists might think that that's like so easy, but for them, it will be like so useful for push their narrative
Yeah.
and advocate for their rights. That's an example. Another example could be you can build up your non-technical communication skills, write blogs, build up your website, talk about issues there, post on LinkedIn, post on Twitter, things that you care about. So the immediate gratification can be achieved through other opportunities. But yes, research is slow, but very, very important at the same time. I wish I could go back and just, start writing blogs by myself every day.
Mhm.
Yeah.
Yeah, that's so funny you mentioned that because recently I've been considering writing a blog, and that's something I never thought I would have done. But it's so important to like really
Yes.
get your thoughts out there, and you don't know. Sometimes you don't see it immediately, but someone out there will find it useful. Yeah.
Yes,
Yeah.
absolutely.
Looking back, what have been some of the biggest challenges that you've encountered?
One of the challenges which I feel that It's persisting, and it's like more of a personal thing for me that being an international student, you are away from your family and friends, that you live at home and you see them probably once or twice in a year. So that's like the most you can do. And like I saw my family like a year ago. So that's the only hard part. And it's gonna stay that way. But what keeps me going is what I'm here for. I want to leave the world in a better place than what I found it as. So I think for me that PhD, everybody says it's tough. It's like I don't want to get in that. I find like there are tough days, there are good days, but
Mhm.
at the end of the PhD, it's who you become as a person, and I see myself changing as a scientist, as a person. My output is not going to be my thesis, it's who I become. So I have no complaints with the professional decisions that I took. Luckily, my family has been very supportive. My friends have been very supportive. They miss me, but I think that's the only thing. Looking back, if there's a mix of, how research capacity can be developed in developing countries, that is what I eventually want to do personally. That how do we strengthen the institutions over there and have, the global north learn from global south and not the other way around.
Mhm.
That's what I want to do. So yeah,
I really love that perspective because it's a lot, obviously this is simplifying things, but a lot of what got us here is uninformed decisions and decisions off of not knowing the entire picture and not slowing down to focus on what exactly we're doing, not just on paper, but in reality. And it
yes.
involves people. So yeah, I really
Yes.
appreciate
Yeah, absolutely. I didn't want to get too emotional, but yeah, that is what I think. Like, yeah, family and friends.
that. Yeah, and also like I'm in my personal life also realizing that especially as I'm getting out of the kind of I feel like it's kind of like a hamster wheel of like focus on academics.
Absolutely.
That's yeah.
Like right now it is like 107 in Delhi, and my family is there, my friends are there, and I'm sitting here in Philadelphia, which is not too bad. It is 87 Fahrenheit right now.
Mm.
But that also like gives you inspiration for the work that you're doing. That yes, eventually you want to be addressing your work will lead to a change in people's lives. Yeah.
Where do you think your work is headed, and are there any current developments in your fields that you're keeping an eye on personally?
Yes. So personally, I want to like move from quantifying like these health disparities, like these health inequities in relation to the environment exist. I want to move from like acknowledging these gaps, which is the first step, to addressing these gaps.
Mm.
How do you address these? So my research is headed towards uh, looking at, so as to say, the broad topics, how our policies and actions, the climate mitigation policies and adaptation policies that are happening right now, because the world is moving, action is happening. Even though slowly, it is happening.
Mhm.
So I want to be in that nexus where my work could help move these policies forward in a better way. And by that, I mean looking at, for example, what are the climate benefits of these policies? How quickly if we stay on a certain track, which have been proposed in a certain adaptation or mitigation policy, how quickly the global greenhouse gas emissions are going to come down in a city or a state or at a national level or a global level. So right now I'm not focused on what geographical scale I want to be working in, but this is what I'm thinking, like what are the climate benefits? What are the health benefits? What are the economic benefits that could be achieved through these policies and actions? And if not, what changes could be potentially be made? So a lot of climate modeling and statistics, but from an angle of informing policies and action. That's where I want to do. And a part of that would be seeing if these policies are equitable. Are they addressing all the weaker sections of the society? Are we addressing all the minoritized groups? Like, is the benefit reaching to them or not? So that's going to be the key component, because right now all the policies and programs, they are at the national level, or so as to say at the state level they're adopted, and they don't talk about the finer distinctions that might be going on within community groups. And that is important if you want to achieve the results as a whole. Otherwise, policies are implemented, we have seen them, but the gains are not there, and we always wonder why. because the policies and the benefits from those policies are not reaching the vulnerable groups.
Yeah, I wanted to say, like, I think from this conversation, like, you're an incredible communicator, so I would love to see that happen.
Thank
But
you.
yeah, I mean, for listeners who are in the same boat as me, they want to keep up with the work that you do, where can they find you?
Best is LinkedIn. So just drop me a message on LinkedIn anytime. I'm very quick to respond over there
So much.
usually. Yeah, absolutely. Happy to be here.